Welcome to a podcast special of Long COVID The Answers. My name is Dr. Funmi Okunola, and we are recording this in March 2026 as part of International Long COVID Awareness Month. Over the past few days, I interviewed some key people at the World Health Organization who care about the recognized international public health emergency of long COVID. The World Health Organization is the United Nations specialized organization for global public health. Its job is to coordinate international health efforts, set medical standards, and help countries in health emergencies. Over 190 countries, which it terms member states, are part of the WHO. All of the people we will interview for this podcast special worked tirelessly to keep us safe during the pandemic. Dr. Maria van Kerkhove is the director of the Department of Epidemic and Pandemic Threat Management at the World Health Organization. An epidemiologist by training, her career spans over 25 years of international pandemic management of a multitude of pathogens, including most recently SARS-CoV-2, H1N1 influenza, MERS coronavirus. Welcome, Maria.
Thank you so much for having us.
Dr. Jamie Rylance is the clinical lead for long COVID and part of the clinical management team of the Health Emergency Program at the World Health Organization. Dr. Rylance was a consultant respiratory physician working in the UK NHS and formerly an associate professor of respiratory medicine and global health at the Liverpool School of Tropical Medicine, with experience of teaching research and investigation of tropical disease in low and middle income countries. Welcome, Jamie.
Pleasure to be here. Thanks.
Maria, if we start with you, how would
Mhm.
you describe the World Health Organization? What is its relevance today?
Well, it's a great question. You talked about it a little bit in your introduction, but essentially we are part of the United Nations that deals with health. We bring people, partners, nations, people, everyone, everywhere together to promote health, to keep the world safe, to serve the vulnerable. And what we try to do is we try to turn science into action, science into prevention, and really improve the lives of people all over the world. So we bring the best minds together to tackle some of the world's biggest health challenges.
Jamie, what do you think the World Health Organization represents?
I think it recognizes a number of things. Firstly, health in its complete sense. So not just not having a disease, but able to have a fulfilling and full life. It recognizes health as a fundamental right, something that's non-discriminating, something that's universal. And it's also a pillar of global peace, global stability. Without health, that sustainable peace is really not achievable. But I think it stands also for cooperation, both at individual levels and at the level of the member states, which you mentioned. And we're here really to support governments, their duty to their people to attain the highest level of health possible.
Gosh, those were both excellent answers. Thank you. Maria, you were very much the who's face to the media during the pandemic. Could you please explain your role to our audience, a lot of whom are non-medical?
Well, thanks for actually not introducing me in the beginning as the face of COVID. That's one of my least favorite things is people to say. I'm an infectious disease epidemiologist, and my role before COVID was the MERS coronavirus technical lead. And when we first learned of this cluster of pneumonia of unknown etiology in Wuhan, China in late December 2019, we set up an emergency team, which we call our incident management team. And as part of that, I was the health operations and technical lead. My job was to work with the people that we have here at WHO and all over the world to turn science, to turn data, to turn knowledge into evidence-based guidance, into strategies. I worked with Jamie during part of COVID because he joined us during that time, but I worked with the clinical management teams, infection prevention and control, risk communication, community engagement, surveillance, diagnostics, basically to tell the world what they needed to do to identify the patients, to care for patients, to prevent infections, to save lives. And part of that was to answer questions for the media. It was actually a small portion of the job that I had. And over the course of the 3, 4 years, I've done hundreds of conferences with our Director General, Dr. Tedros, and our Executive Director at the time, Dr. Mike Ryan. It was an absolute privilege to do those press conferences. to essentially answer what we know, what we knew, what we didn't know, what we were doing to find out, and really importantly, what it meant for you, the audience who was listening to us, whether it was journalists or presidents or parents. How do you keep you and your loved ones safe?
Jamie, could you please explain to our audience your role at the World Health Organization and how you represent people with long COVID?
Sure. Well, I think at the general level, we bring together people, stakeholders, anyone who's involved in improving the life of people. And we try and keep a science-based response. We produce a lot of guidance as a result that brings the people and the science together. My job in WHO is a bit more clinical, so it's where the public aspect meets individuals and patients, as you would call them if they were admitted to a hospital, for example. My job's less about the prevention and more about the response. And as part of the safe and scalable care in the emergencies program, often responding to acute episodes of infectious disease, and we've mentioned COVID-19, but understanding that although I'm a hospital doctor by training, health and patient journeys start well before that and finish, as long haulers know, well after that. And so really making sure that we have a response that is tailored to an individual as best we can from this very global level, but using all the expertise we can, patients, professionals, organization, everybody. I think from the science point of view, we are a source of honesty. I think we are honest about what we don't know. We support the scientists and the global science community to fill in the gaps. And I think from long COVID, there's been a huge amount of effort and substantial improvement in breakthroughs. But then subsequent to that, well, what do you do about it? So we issue guidance about how to put that science into action to make people's lives better.
Maria, you and I met in November 2025 at the UBC Centre of Disease Control Global Health Security Summit in Vancouver, Canada. You were the keynote speaker there, and as a big long COVID advocate, I was really inspired by your speech, as your opening line was, "We are not really post-COVID. We are post-COVID crisis, and it's still very much with us." And I think we really need to address this, as I think there is a collective amnesia about wanting to put this in the past, and it's really not in the past. I'm quoting you there. Can you please elaborate on that statement?
Yeah, I think many people want to think we're done with COVID, that COVID's over. It was a very painful part of our lives. Many of us lost loved ones, trajectories of people's lives changed, livelihoods were altered. And I think many people, because of the trauma that everyone went through, really wants to put that in the past. But COVID is still very much with us. The virus, SARS-CoV-2, is still circulating and circulating in all countries, certainly not at the level that it was during the crisis of COVID, but we still have people with acute infection, acute disease, and we have many, many people with long COVID. And so for us, for the rest of the world, for governments, for ministries of health, this is not over. And I think it's important for us as the World Health Organization, as the world's health organization, working with governments to keep people safe, we need to keep attention on these threats that we currently face because they're still very much with us. But also, everything that we've done for COVID is important for the next one. I think I also want to make sure that for those who are suffering from long COVID, that they're not forgotten. The legacy of COVID cannot be just death and devastation. It needs to be what we're doing to make these systems better, to make sure that the next time we are better prepared, and that we still continue to care for those who are suffering from long COVID, who are suffering from acute infection, who are still dying from COVID.
Thank you so much for that statement. I know it will mean a huge thing to all of the people suffering from long COVID out there. Thank you for saying that. So, Jamie, long haulers feel forgotten, ignored, stigmatized, and marginalized by the medical profession and the non-medical public. As a clinical lead for long COVID at the WHO, what are you doing and who are you working with to combat this situation?
Yes, so still many years on, it's similar issues that we're facing, and raising awareness in all of the people that you mentioned is really important. The recognition, as you say, that neither the pandemic nor COVID-19 are over for any of us, really. And people's lives and health systems can be quite messy and difficult to navigate quite inefficient. And one of the things that we're trying to do is improve the navigation of those systems, improve how patients understand their disease, how doctors understand their diseases, and how researchers are working to improve treatments, for example. Knowing where do I go, communicating the entry points to healthcare, and seeing what models work in different places, because clearly one size does not fit all when we're talking about members. But really, what can we learn from each other? And that's most obvious sometimes at the research community level, where everyone builds on everyone else's success. But pulling together the different aspects, parts of treatment, the rehabilitation, the mental health aspects, laboratory science, and learning from best practice. And so we try to bring scientists together within that context to talk to each other and to set up some simple tools for education, for example, for doctors and patients, to help the scientists underpin their work by harmonizing the data and the definitions, and lots of technical work that needs to underpin that. But also, certainly with our colleagues in the regional office in Europe, doing some of the research, looking at cohort studies, what are patients suffering with now from the later infections from COVID, not from the early pandemic, from when our data mostly come. And putting all that, people and the science together again, coming up with guidelines as part of our living guideline on COVID-19, which includes rehabilitation and other treatment aspects, and also supporting other disease guidelines which are associated with COVID-19 and long COVID, but aren't always ostensibly about them. So really bringing some sense that this is a patient need, of people's needs that can be asked and answered across a bigger range of aspects.
Oh, thank you. I really feel the passion with both of you that you're rooting for long haulers out there. Maria, on March the 11th, 2020, the WHO Director General, Dr. Tedros Ghebreyesus, declared COVID-19 a pandemic. That's just over 6 years ago. We now have the public health crisis of an estimated 400 million people worldwide suffering from long COVID as a result of SARS-CoV-2 infection. Without a cure for the disease and a medical profession that is not providing adequate training for diagnosis and rehabilitation, what is the WHO's role in managing this?
So we first started meeting patients with long COVID, or advocates for patients with long COVID, in August 2020. And what they asked for with our Director General, who came to that meeting with me, with Janet Diaz, who's the head of the clinical team, and they asked for three things. They asked for recognition, they asked for research, and they asked for rehab. And that first one on that recognition was so critical and remains critical because this is happening. This is something that is real. WHO is making sure that there are strong case definitions, and that may sound very simple, but when we say long COVID, people mean different things in different countries. For just us to have an understanding of what the scope of this real issue is, we need to have the medical community talking about the same thing. We need to make sure that we have treatment for people who are suffering from long COVID, dealing with many different parts of the body. And Jamie touched upon that in his previous answer. And we need much more research. There's more that we understand, of course, but there's far more work to do to better understand what is actually happening, to guide the treatment options, to drive rehabilitation. And so for us, one of the major things that we do is, one is we keep up the recognition, we keep up the awareness of this because this is real. We advocate for this. We are constantly looking for funding to support research, to support cohort studies, just to have the investment to better understand this. And we're making sure that we turn whatever evidence we have into guidelines, into guidance to keep people safe. So it's turning that data, that knowledge from knowledge, know-how into how-to. And that convening power is really important. Just to be heard is important. And what Jamie was mentioning is we don't only work with clinicians, we work with patients. We work with patient groups to make sure that what we do advise is applicable, is acceptable, is implementable, that we can help as many people as we possibly can. So for us, this isn't over. And I want to make that really clear. You may not hear about us talking about long COVID every time. We certainly don't get questions about it like we used to at the press conferences, but this is something that is a priority for us. And we really do need more attention to this by governments. We need more funding for this to continue to better understand it. And really importantly, to have better guidelines to support patients.
Oh, thank you. Jamie, privately, you and I have discussed the need for a consensus definition of the post-COVID syndrome. Could you explain what this is and why it's important?
Yeah, thanks. So we've used a few different terms to try and describe the same thing, even on this interview: post-COVID condition, long haulers, long COVID. And that's just in the use of the language. What underpins that and how you identify people that are suffering from it, people that are at risk of it, or people that might be treated for it, we all really need to start speaking the same language. And WHO were really early, I think, to develop the case definitions for adults and for children. They were pragmatic, they were broad, they were based on symptoms. If you had symptoms of it, you could, have a diagnosis of long COVID or post-COVID condition, as we would call it, and follow that through. But I think there's an increased understanding now of different patterns, different subtypes of disease. Clearly, patients are all different, but there are increased recognitions of clusters of things that can be recognized scientifically and medically because they have unique treatments. And there's equally an increased recognition of the post-acute sequelae, meaning the things that happen after COVID infection that are probably not captured if we just talk about symptoms. And we've talked about some of the organ dysfunction and the damage that the virus and infection can do to your body. Don't capture that well in the current definitions. So there's a challenge. The definitions need to be specific because we have to know what we're talking about, but they have to be inclusive. They have to make sure that everyone is counted. They have to be stable to be useful because everyone needs to know where they are, but they also have to respond to the changing landscape over time. And so I think now is a time when we're reconsidering whether the case definition from 4 years ago now, 5 years ago, is still the best it can to make sure that everyone's included, everyone's talking the same language, and together we can face the medical and the research and all the other social challenges that we need to face.
Yeah, very much endorse that. And we've talked about how the virus really affects every organ in the body, and it really is impacting on the whole community. We're seeing increases in type 2 diabetes and kidney disease and heart disease from SARS-CoV-2 infection, probably repeated infection, as well as long COVID. And then people are still hospitalized with COVID and come out with organ damage. So there's all these different effects that the virus has. That's what you're trying to get, isn't it, in that new consensus definition you're working on?
Exactly right. Yeah.
Great. Maria, why is International Long COVID Awareness Month important?
Well, it's important for, I think, three reasons from my point of view. One is that we keep up awareness, we keep up the attention to what is happening and what so many people are suffering from, for all the reasons that we've talked about in this podcast. I think it's important because people need to feel heard, that their voices are heard, that their voices are important, what they're going through is important. And the third reason is, bottom line is we're all people. We're somebody's parent or child, friend or aunt or uncle, and we see what it's like to watch one of our loved ones suffer. And we all want to do whatever we can to keep our loved ones safe and healthy and happy. And so the awareness about this is important. And again, I really want to reiterate that at the World Health Organization, this is important to us. As Jamie said in the beginning, we look at the whole health of the individual. We look at their mental health. We look at everything surrounding their ability to lead healthy lives. And we take that very seriously. We are here at the World Health Organization not because we have to be, because we want to be. And we get to work with people like you. We get to work with people, experts from all over the world, again, to bring the best minds together to solve these really, really complex problems. And that's a privilege.
Jamie, what does International Long COVID Awareness Month mean for you?
I've been thinking about this, and I think it addresses four U's. One, Maria's already mentioned, unheard people. Advocacy and awareness of those unheard voices is still so important. And unanswered questions. People with long COVID still left without the answers, still the stigma that we've mentioned that really needs to be addressed. underfunded. It needs to be a rallying point for funding and to make sure it's high on the agenda of everyone, but particularly people that can help drive improvements in research and those things we've talked about. And lastly, untreated, because I think there's an under-recognition of symptoms and the access to care that people need. It needs to be individualized, but they need to recognize it and need to be straightforward pathways to get that care that they need and to support the individuals and the family and community around them.
Thank you both for joining us today. Really powerful interview, actually. And I really feel from this interview that the World Health Organization is doing so much to help long haulers. You know, you're like a swan, but busily sort of working those feet under the water furiously as you glide along. Yeah, really feel uplifted and inspired by what you've both said today. Thank you for everything that you do and for keeping us safe during the pandemic. And I know you'll do the same for the pandemics to come. Thank you for the wonderful work that you both do.
Thank
Very
you so
welcome,
much
and
for
thank
having
you.
us.
Cristiana, would you like to introduce yourself?
Thank you very much for this opportunity. My name is Cristiana Salvi, and I'm the Regional Advisor for Community Resilience and Protection in the Health Security Division at WHO Regional Office for Europe, based in Copenhagen.
So, Cristiana, what is community resilience and protection and health security at the World Health Organization?
Community Resilience and Protection, or the way we call it, CRP, is about putting communities at the core of emergency management, so health security, not just as beneficiaries, but as partners. And communities, we need to realize very clearly, they are not passive recipients. They are agents of their own protection. This approach has quickly become central to health security, is now one of the main building blocks of the Preparedness 2.0 strategy and action plan that all member states in WHO European region signed off at the end of 2024. And that means that countries are expected to build emergency health systems that are truly centered on people's needs.
So, what role did this job play during the pandemic for you?
It was critical, and COVID-19 made that very clear. At the time, a CRP, Community Resilience and Protection, wasn't very established in the European region. There was not much documentation and not many concrete examples we could draw from. What the pandemic showed us is that it's not enough to deliver the vaccines, the treatments, the text. What really matters is that people understand them, trust them, access them, and use them. In simple terms, what matters is not vaccines, but vaccination. And even more, that communities have the knowledge and skills to own their solution and themselves to deliver these services and intervention that are meaningful for them. When we engage community and build on their strengths and overall on the trust that they have with each other, we see much stronger acceptance and uptake of protective measures.
That's really, really powerful. Thank you. Tell us about RCCEIM. What does this acronym stand for?
This is a pretty complex acronym that stands for Risk Communication, Community Engagement, and Infodemic Management, and is central to community resilience and protection. This area only work well when they are together. Risk communication is about providing timely, trusted information based on community insight. Community engagement is working together with communities to co-shape and co-deliver intervention. And infodemic management is about addressing false information and building resilience to it. And together they empower people to take informed decisions to protect their health. In the European region, traditional risk communication had been stronger and more developed. Community engagement, infodemic management were lagging a little bit behind. So throughout these years, we have been working with countries to build these capacities and integrate these three disciplines to make really one. Learning also from the recent emergencies that have hit the European region.
This was your development, wasn't it? I understand. What inspired you to do this?
Well, I've been part of response and preparedness in health emergencies for the last, I would say, 24 years. I've been working in the field for long years and I've been deployed also in countries that are different from countries in the European region, including in the African region, in Asia. And I've been learning a lot from the experience of the community engagement. I would say that community engagement has been more solid in these areas, and we have been learning from this through over time. But at the same time, COVID came up with our single opportunity to understand that unless we engage community, we work together with them and not only for them during emergencies, that we can truly control outbreaks.
Could RCCEIM be used to raise awareness of long COVID? And if so, how?
Absolutely. WHO Europe estimates that around 36 million people in the region experienced long COVID between 2020 and 2022. And the fact that there was less testing or no testing at all after that means that the real number is much higher. At the same time, long COVID is still a condition where evidence is evolving. So responding effectively also means learning from people's lived experiences. That's where RCCIM comes in. It helps by basically engaging patients, listening to them, their concerns, their needs, supporting health workers to have a dialogue with them based on empathy, and help communities at large better understand and accept the condition. It also plays a very important role in reducing the stigma and building trust as knowledge continues to evolve.
So RCCIM is really powerful from your description and really necessary for long COVID advocacy, awareness and education. How can we implement this internationally in our countries and our health services?
So this month is extremely important because it gives visibility to a condition that is still not fully understood and consistently recognized. And one of the main things is that it helps challenge stigma, which is a main barrier for people trying to access care while also validating their experience. And it's also a key message for decision makers to invest more in research, in diagnosis and access to services. And importantly, it helps ensure that the patient voices are heard and included in policy and practice.
Wonderful. God, what a wonderful world would we be in if we could get everybody to successfully implement what you've created here. How has your department at the World Health Organization marked International Long COVID Awareness Month?
So we marked it by relaunching our mythbusters on long COVID, and I'm going to explain what it is. We developed them, launched on the 30th of January, which was the anniversary of the public health emergency for international concern to be declared on COVID. So we thought it was a very good opportunity and occasion to launch the Mythbuster, and we are basically promoting the Mythbuster stronger during this month. So what are they? Let me just say that misconceptions continue to hinder diagnosis, prevention and care and rehabilitation. And with the support of the European Union, we have developed these Mythbusters that basically use social media assets to combine evidence-based information with real patient stories. In a nutshell, this is a very strong example of RCCIM in action. First of all, we worked with the community groups to really get their insights on what are the rumors, the false information circulating, and what we want to address. And then we developed these evidence-based techniques to counter these myths, which are proven and successful in the context of infodemic management. We also expose the techniques that those that manipulate information use so that people can believe in false information. And this because so people are more equipped to use their critical judgment when they encounter this information. And at the end, we also use these patient stories. So stories that are from people who have been living through long COVID, so that they can foster trust and empathy, and that can really connect and truly connect with people at the human level.
Oh, thank you, Cristiana. And yes, we at Long COVID The Answers have connected with your department on that. And we've been sharing and promoting Mythbusters on our website and social media. So please, listeners and watchers, go and have a look and visit the World Health Organization website to see those Mythbusters accounts. Okay, so thank you for all that you do, all that you've done to keep us safe. You're doing some amazing, wonderful work, and we truly appreciate it. And thank you for everything that you and the World Health Organization does for raising awareness of long COVID.
Thank you so much for having me, and thank you so much for your work in spreading the truth.
Leo, would you like to introduce yourself?
Sure. Thank you. And I'm pleased to join you. I'm Leo Palumbo, and I'm the Technical Officer on Community Engagement in WHO Europe's Health Security Division.
Leo, what is community engagement at the World Health Organization, and what role do you play in this?
WHO defines community engagement as the process of building relationships with community actors. And we also are moving that from something that has been applied into emergencies like Ebola and used in universal health coverage to broader emergency response. I started with the World Health Organization shortly before the COVID-19 pandemic. So my role in terms of community engagement is developing initiatives alongside health authorities to engage at-risk and affected communities. For an example, for COVID, we set up community engagement initiatives in 8 different member states, but essentially setting up projects to tailor the COVID-19 response to realities faced by communities in those countries.
Right. Yeah, so you had a real baptism of fire starting just before the pandemic.
Indeed.
So I'd like to quote one of your phrases referring to your skills and experience. You describe yourself as making policy change happen by connecting marginalized groups to policymakers. Really powerful. Worldwide, there are 400 million people with long COVID. How can you realize this statement through your work at the World Health Organization?
How I view it is if you look at a lot of the existing knowledge on tackling health equity, what you see is oftentimes marginalized groups are underrepresented in statistics. And this essentially means that they remain or can be invisible to policymakers because their needs aren't always taken into account because they're not counted for. So, how I view community engagement in one sense is making the invisible visible. So, to go back to the example that we're here to talk about today on long COVID, one of the things we did was using patient stories. So, a way to actually make visible what is the reality of someone who has long COVID. If you look at the policy perspective, it also means a couple of things. So one would be it's important to set up mechanisms for communities to share their concerns with health authorities. I think another thing health authorities who are interested in long COVID would have to do is map out who are the at-risk and affected communities that have unmet needs. So for long COVID, that might be children. It also might be working with organizations and groups that might not be the usual suspects in the health sector, like groups of people living with disabilities. Even though the whole point is they should be usual suspects because you should be working with groups who are traditionally left behind in order to address their unmet health needs.
Yeah, I think we have a really big problem with even getting health authorities to acknowledge that long COVID is an issue. So we're really starting from quite a way back. So how do you think we could implement the ideals that you realize from an international viewpoint to a local one? How can we, as long COVID advocates and people living with long COVID, try and really wake up our health authorities to the fact that we have these needs?
I do see some positive examples. Our work on long COVID is in partnership with the European Commission and the Organization for Economic Cooperation and Development. The European Commission has set up a network of experts on long COVID, and they also have an open stakeholder group. As part of those meetings, almost every meeting that I've been to, there's been a patient representative. I think that's one practical way, let's say if you were organizing a conference or event, to incorporate lived experience. There are other alternatives that could be looked into. One thing that we saw during COVID is some municipalities would set up advisory boards. I would also say this is probably a good practice from long COVID is also patient groups and affected individuals have organized themselves. So in many ways, they join together to fill a need that's not being met. And what needs to happen now is actually finding ways to dedicate resources to continue that work. But the reason why I bring that up is something that I think that's been very powerful that we've seen in other examples, most notably the response to HIV and AIDS, that having organized civil society has made a big difference in terms of both the access to treatments and also having resources dedicated to research in that area. So I think for long COVID, because it's something that is an emerging issue, I don't want to say new because many people have been living with it for a number of years, but there's always a bit of a lag between policy responses. So for that reason, it will take some time to catch up. But I do want to say that there are some existing good practices, and I think that, let's say, local communities have to see what would make sense for their community, whether it's writing to their local health authorities. Participation could also be along the lines of how to improve the patient pathway for a specific health facility. How do you help patients navigate different services that they need? So I don't think that there'd be a one size fits all solution, but there's definitely promising practices that can help both make patients' voices heard and also bring their reality into view.
Thank you, Leo. Tell us about Mythbusters and the role you played in realizing this initiative.
Thank you for asking about that. That's something that's really close to my heart and I'm really interested in. So the Mythbusters series is something that we worked on alongside what we at WHO Europe call an informal working group. So with different representatives from patient groups, affected communities, clinicians, and rehabilitation specialists, we engaged in a process of finding out what are the most reoccurring myths. Then we did a prioritization exercise about what is the most harmful from them. And then WHO experts worked on debunking the myth, so using facts to set the record straight. And we also worked on interviewing people with lived experience who are involved in the informal working group in order to match stories with the myth. And the idea behind this was we want content in an online world that can be sticky. So you want content that is memorable. And another thing that I view as important in the initiative is also starting with facts. So oftentimes rumors spread, and then when you try to dispel them, many people focus on the myth when you should actually focus on the fact and reminding people about the evidence-based information in order for that to be ingrained more in people's memory. So as part of the exercise, we also ran a training from a working group on what we call the truth sandwich method. But it was a really exciting project because even from when we started working on long COVID, we've heard from many community representatives that health workers don't always believe them. Sometimes also people have misconceptions about long COVID. For instance, that it might only impact people who are, compromised, or if you're young, you can't get it. So we did work with affected communities to find out what these myths are and debunk them. Another big one that we hear a lot is sometimes people feel like it's only in their head. So in the Mythbuster series, try to address that. No, long COVID is a real medical condition. There are mental health impacts, but it is not only in someone's head. And it's also been great to see that the Mythbusters have been picked up almost globally. Like even in Australia, a university, we've seen patient advocates in countries throughout the European region share them. So it's also been really rewarding to see that something that we worked on is contributing to a gap.
Oh, well done on that. And you can see the Mythbusters on the Long COVID the Answers website, on the World Health Organization website, and on social media. We've shared and tagged those. So thank you, Leo, for that. Why do you think International Long COVID Awareness Month is important?
It's important for a number of reasons. I believe that awareness is often the first step in behavior change. So if you do want someone to enact a new behavior, first they need the knowledge about something. But beyond that, awareness is also prerequisite to dedicating more resources for research. And I do view is International Long COVID Awareness Month as an opportunity both for workers to look into what is the latest science on long COVID, if there's any courses on how you communicate diagnosis with patients. For other types of specialists, like rehabilitation specialists or even social workers, it's also an opportunity to look into how their roles interact with the long COVID community. And then so for patients and people living with long COVID, it's an opportunity to share their realities and how they've been impacted by the condition. And that's one of the reasons why I'm really pleased to join the podcast today. Long COVID Awareness Month does represent both an opportunity for people with the condition, people working to support them, that ultimately is a moment to draw attention to the fact that even though for many people COVID is over and the pandemic's no longer part of their daily realities, for millions of people it still is.
Oh, thank you, Leo. That was very well said. Thank you for all that you do and for agreeing to be interviewed today. We in the worldwide community really appreciate that you kept us safe during the pandemic and that you're working tirelessly to raise awareness and to advocate for long COVID.
No, thank you for having me and best of luck with the podcast. And it's always a pleasure talking with you.
Well, we hope that you enjoyed this podcast special that we worked to bring you to mark International Long COVID Awareness Month of March 2026 with the World Health Organization. We at Kajala Medical and Long COVID The Answers felt it was necessary to shine a light on one of the most important organizations in the world and inform all of you living with long COVID that you haven't been forgotten and that there are some very talented and dedicated individuals at the WHO working hard to advocate for your health needs. Please discuss your thoughts on our social media outlets such as Twitter or X, Blue Sky, the website blog, Instagram, Facebook, TikTok, or LinkedIn. Please rate, review, and follow us on social media. Subscribe to our YouTube channel and visit our website at longcovidtheanswers.com. All of this really helps to keep our organization going. Goodbye for now.